presentation, which will be looking at understanding health and social care research. Understanding health and social care research. What is research? Simply, it's a systematic, deliberate process of investigation designed to develop or contribute to generalizable knowledge. You do research because you want to contribute something new, because you want to develop, or you want to contribute to existing literature. And the point of research is systematic. It has a process, and it's something you do deliberately. And according to Albert 2003, it is a process of systematic inquiry that entails you collecting data, documentation of critical information, you analyze it, then you synthesize this information with suitable methodologies. So why do we do research? The essence of research in health and social care is to improve evidence base. We want to reduce uncertainties, and we want to improve the care that is given to the patient. So when you are doing research, there has to, in most cases, there has to be a gap in literature. There must be a problem that you want to contribute to. And any form of research actually have three major phases. You have the planning phase that you do before you begin the research. And this is a process whereby you do different literature reviews, you check literature so as for you to be sure that you are not duplicating what has been done before. And at this process of planning is where you do a lot of thinking, do a lot of critical thinking on the methods you are going to adopt, how you are going to analyze it, who will be your participant, how you are going to sample your participant. Then you have the implementation stage, which is the point by which you will actually get your data, or you do the real experiment, depending on the kind of study you are carrying out. And one very important aspect of research is one important phase of research is the dissemination of research findings. Because after you have planned your research, you have implemented your research, the findings you have now been able to have to be disseminated to important stakeholders or those who are going to make use of this research. And you do this through different means, through stakeholder meetings, through publications, through presentation at conferences or a symposium or workshop. Like I said, the planning phase of research is a period whereby you do a lot of thinking. So what are the responsibilities of researchers? What do you do as researchers? What are your responsibilities? You are responsible to develop ideas with due acknowledgements of what have been done in the past. You have to be able to acknowledge what other people have done, and that will be the basis for which you are now adding to new knowledge you get. So, and one of the responsibilities of researcher is you now develop a scientifically sound proposal, or sometimes you call it protocol, where you then design smart objectives, objectives that are specific, that are measurable, that are attainable, that are realistic and time bound. And in some cases, not in some cases now, in most cases, your objective has to be relevant and must be ethically sound, and then as the researcher, you begin to also develop reliable and valid instruments for data collection. It's part of your responsibility as a researcher. Is your instrument reliable? Is it valid? Then you also begin to design sample size, what will be adequate sample for this particular study, how are you going to collect data? These are some of the things you develop, and all these are always well detailed in your research protocol. And you also plan for data analysis. You also plan for your dissemination. It's part of your responsibility. You plan for the process of ethical approval. Now, why is research in healthcare very important? And why do we even do research in health and social care? The core reasons for health and social care research are, number one, is for us to be able to use evidence to plan, implement, and improve health and care. We want to be able to use evidence, research evidence, to implement and improve healthcare system. Nothing will be done based on guesswork. It's going to be based on evidence, based on research evidence. And of course, research in health and social care is done to enhance the quality of health and care provision and to develop best practices. We do research to develop best practices and also to be able to meet patients' and service user need. That is the core reason why research are done in health and social care. So we have different research methodology in health and social care, and in health generally. There are different methodologies you apply in health and social care research. And we have the case series, we have cohort observation, you have control trials without randomization, you have epidemiology, methodology, you have the quantitative research, you have observation, you have randomized control trial, you have interview, you can use questionnaire, there are a lot of methodologies which we are going to be looking into details in subsequent presentation. But one key point that I want us to know at this time is that research is central to improving healthcare, and that's why it's very important. And that's why people like us are passionate about it, and that is why I'm sharing this, just for us to have some understanding about why research is done in health and social care. We need to know that it is central to improving healthcare, to improving patient outcome, and even to healthcare services in order to inform best practices and decisions. That's basically why we do research. So in subsequent presentation, we'll now look at different methodologies, what we need to do to have to do research that will really be able to change, that will be able to meet the needs of the people, and will also be able to solve societal problems. Thank you very much for your attention.